Bismillah ar-Rahman ar-Rahim. This is Ali Zagbi. Today, inshallah, I'm going to share with you, as the title says, Angiolipoma. So we have here well circumscribed lesion, which is predominantly fat, and here we can see the pink at the periphery especially, and extending to the center. And as the name suggests, angiolipoma. So we have two components: angio, which is refers to the vessels, and which is in the small specimen. Usually we see it at the periphery, and lipoma, which is adipose tissue forming a mass. So we have here the mature adipocytes, and here we have the vessels, which are thin walled blood vessels. Here is the thick wall blood vessels. Here are the thin wall blood vessels, or we can say capillaries. And if we go hyper, we don't see any atipia, we don't see any mitosis. Thin wall blood vessels here and there. Here is very striking, to be honest. Very noticeable. So this is very textbook example. This is example from Bath presenter. This is angiolipoma. So fat mature adipose tissue with thin wall blood vessels. Sometimes we see in good examples a fibrin thrombi. I think here it's like this one, but I think because of the staining or because it's digital slides, it has this different color. So we see it in the thin wall blood vessels. So we have three essential features: the thin wall blood vessels capillaries, the mature adipose tissue, and the fibrin. So that make our diagnosis angiolipoma. So briefly, angiolipoma, as the name suggests, angio, vessels, lipoma, mature adipose tissue forming a mass. Angiolipoma have three essential features: the mature adipose tissue, cluster of thin wall blood vessels, and fibrin thrombi in the blood vessels. And usually it is pink. But our example, because it's digital slide, it lost the stain or something, I'm not sure. The slide from Bath presenter. It is usually male predominance. A very important feature, it is tender or painful on examination clinically. No risk for malignant transformation. As we said earlier, vascularity is more predominant at the periphery. We'll go back to the slide to see it more slowly. This is a very good example of angiolipoma. Fat and the vascularity. No atipia, no mitosis. And that's it. Thank you very much.